Welcome to all parties joined, and welcome Sarah as well. I would like to start by thanking you for accepting to chat with us. As you may know, Project 42 is a show, an idea that was conceived to help inspire us now that we are in a 42-day lockdown. Not yet, we don't know when is this going to, or when this is going to end. Source for inspirational people who can talk to us, give us hope, keep us sane. In the meantime, I would like to thank you for accepting to chat with us about a very sensitive topic, something most people do agree with. To start with, Sarah, may we know you? Who is Sarah?
Thank you so much, everyone who is on this call. I really appreciate you all for keeping time and starting with us. I hope you can all hear me. Thank you, Monica. I'm called Sarah Poro, just like you mentioned. I'm a very passionate person when we have to talk about stigma, because I know it's one of the reasons why, as persons living with HIV, we are facing a lot of challenges here and there, because you can't do certain things that you have to do. I work at Makerere University Business School in the office of the Deputy Principal. For those who can check us out after the lockdown, right now we are still under lockdown, all universities are closed. But I'm really glad that we can have this conversation and we keep going. Thank you so much.
So you have already told us where you work. One of the things that is very, very inspirational, I would like for you to share with us about that day when you discovered that you were positive, that story, what has brought us here now.
Good morning. Okay, I'm seeing someone else on the screen, but I really appreciate the day I got to know about my status, because it was a life-changing moment. That was in 2017, January 2nd of January 2017. That is when I got to know about my status, and I can say that is when the journey of positive living started. It was those random, those random tests that you walk into the into the clinic or the hospital and decide to do a test, not expecting, of course, for it to turn out positive. But yes, that is when my journey began, Monica, on 2nd of January 2017.
Okay. Can you hear me? Yeah, that's great. I really am touched, because one of the things that came up is how you decided to post it, to post your status. What was the inspiration behind that?
I am one person who is so open about so many things. I tend to speak about things that people are quiet about. I decided to come out about my status. That was on 30th of April. I plan everything I do. That was on 30th of April when I decided that instead of keeping this status to myself, why not share it with the world, so that I'm not going to live with the guilt of having to hide while taking my medication, having to face the stigma that comes with people not knowing your status. And one of the major reasons why I really came out was there was no face to HIV. We were just looking at people and assuming they are negative or they are positive, but there was no face to HIV. So to me, coming out was one, to inspire people that, you can live positive and live a fulfilled life. And also I decided to come out public about my status because I realized there was a gap in the communication. I like to speak so much about, I work in a university, so I thought this would be a good opportunity to reach out to the students, to reach out to the people around me and tell them more about HIV, that look at me, I'm facing it, I'm going through this. And that is where my journey began, because I wanted to break the stigma that surrounds people living with HIV. They expect you to look slim, they expect you to look in a certain way. So I wanted to break the image that we had about people living with HIV.
Wow, and you really did. You're doing a great job. I get it that following your story, this was kind of deliberately, in quotes, given to you by somebody who claimed love you more than any other person, or what's the relationship you have with this person?
Okay, this person, I prefer to leave him anonymous till forever. He was my ex, and we were dating at that time. So as many would be in a relationship, and you eventually get to engage sexually, but partially it was his mistake because from the look of things, he knew his status, but I think didn't know how to tell me. And partially it was also my mistake because I did not test to this man before having sex with him. So to me, that was, I take part of the blame, but to a larger extent, I feel he should have just told me his status so that I get to know how to deal with it. Yes.
Maybe what I can ask is, have you forgiven him?
Oh, well, so many people ask me that question. And, this is something that when it happens to you, you just don't know what to do to such a person. I've been asked by so many people, what exactly am I doing with this guy now? But I can tell you from the bottom of my heart, I let him go in a way that I'm no longer in a relationship with him. I forgave him from the bottom of my heart. I told him, you know what? We made our mistakes. You made your mistakes, but I need to go on with my life. So if you asked me what is the kind of relationship that I have with this man at the moment, I'm glad to let you know that we actually talk. I actually talked to him this morning. I haven't talked to him this morning, and we talk, we chat, I'm in a space where I had to do it for me. I had to forgive him for me, because the more I held him in my heart, the more I made it feel like every time I saw him, I saw this man who infected me. So I had to choose it from right within me to forgive this man. And I can gladly tell you that he recently got married.
Yes, I'm asking, since you decided to go public about status, you were on a big house in the country. What was the reaction to that in relation to stigma? How do you handle it?
If I got your question right, where you're asking about what was the reaction of the public when I came out positive. This was a time when I was already working with the university where I currently work with. I was already having friends around me. I had a family. So coming out about my status was quite a blow to so many people. I had shared it with a few of my, like two of my friends, and I'd shared it with some few of my family members. So I kind of prepared them, though I'd not prepared them in a way that I'm coming out public about my status. I prepared them by telling them my status. So the reaction I got from my employer, I came out public when I had already accepted myself, because I came out public about my status after 4 months of getting to know my status. And to me, that was enough time for me to heal and step out to the world and accept any kind of criticism or any kind of reaction that I may get from the public. But I can confidently say that the reaction from the public was quite heartwarming, because my family have been so supportive of me from day one. My friends whom I used to hang around with and they didn't know my status, I was shocked by their reaction. I didn't really feel any difference between them associating with me before and after getting to know my status. And my employer as well, my boss, whom I currently work with, I didn't really see any serious signs of being stigmatized. So apparently I can say not everyone gets the warm welcome that I did receive, but I know there are people out there who are struggling to even share it with their spouses that they live with in the same, in the same house. So to me, it's more of, how do we really embrace each other? But I got the greatest embrace, if I can say that, from the people. Yeah. Monica?
It is not easy. Yes, I can hear you. It's not easy to come out with something like that. And I want to believe that so many people have sought counsel from you. Is that right? How do they come to you, and how do you take them through? If I may ask, basically.
Personally, currently I'm doing a course in counseling psychology. I realize it's something that I'm passionate about. And with that, it exposed me to getting to know how to talk to people. I am approached by people from different backgrounds, people outside Uganda, within Uganda, because I'm currently in Uganda. Okay, I'm distracted a bit by someone's video, but okay. Apparently, I'm in a place where, sorry, there's someone distracting me called, is it Ada? Hello? Monica, can you hear me?
I can hear you.
Okay, fine. Okay, I was just trying to explain. I'm approached by married people. I'm approached by singles who have just got to know their status. And also the other surprising bit, people who just assume they are positive and they already feel they have the signs. You know, one thing about the body is it reacts to what you direct it to. If you feel like you have the signs and symptoms of HIV, you will definitely have the signs. But to me, there are people who come and they're all scared around and they don't seem to. But to me, the first thing, before I even start telling you to take your medication, I always ensure that the people I counsel have tested and they are positive. And those who may want to find ways of ensuring that they do not contract the virus.
Yes, I still get it. I'm talking from the point of view of a video that you shared with me this morning, how you are simply and easily taking your medication. Let's talk about adherence. What drives you? Because we've woken up to loved ones who have said, no, I'm done with this medication, I'm not taking it, and then you've lost them. What drives you to adhere the way you do?
Okay, from day one, I decided that because I had prior knowledge about HIV, I knew that people who are living with HIV have to take medication for the rest of their life. So I had some bit of knowledge about what really goes on around the lives of people who are living with HIV. Though I didn't know it to the depth that I know now, my courage to take HIV is strictly for me, because I have seen people who die because they are not taking their medication. I have seen people who come from undetectable viral load to millions and millions of viral load, detected in their bodies. So to me, I'm in a place where I'm doing this first for me and probably for the person whom I'm going to have sexual relationship with. That is in future, because I know that when I take my medication very well, and right now I'm in a place where I am undetectable, and that means I am unable to transmit HIV sexually. So to me, I am doing it first for me, and in whatever you do it for you. Maybe there you get the motivation to keep doing it. I move with my tablets everywhere. I carry it because I do not know where 11 a.m. will to 11 a.m. Anywhere you find me at 11 a.m., I'm taking my medicine, whether I'm in a taxi, whether I'm in church, whether I'm on a border. Okay, usually I plan so that it doesn't get me in weird places because you have to disinfect your hands and all that. So to me, this is not what happens to everyone out there. I have seen people who go to pick their medication. While picking their medication, they have to pack it in a kavera because they do not want people around them to see that they are carrying drugs. Now, this is very dangerous for them. While at the hospital, we are told to always keep our medication in the pack, in the bottle, because it's more safe there. But I've seen positive people who cannot afford to carry this bottle everywhere they go to. Why? Because they think someone will see it and start stigmatizing them. Now, that's where stigma comes. I am so free with carrying my medication everywhere that I go to because I know the value of moving with it. And I know the value of keeping it in the container. But unfortunately, because of stigma that is associated with HIV, people who are positive are unable to carry their medication. They hide it. Some I know. Okay, I remember the 4 months that I was hiding my status from people. I didn't want people to know. I was at a party and around me, there were so many people, right? And trust me, I had to hide somewhere. I had to walk out of the party hide somewhere and take my medication. You know how that is painful, but I'm in a place where I don't really care what you think about my status. To me, life keeps going.
You are a gem for this country. If I had the power, I wouldn't just let you go. Let's talk about COVID right now. It seems to have stolen the show, right? For lack of a better word, let's say that the whole world has shifted attention to it, and people don't seem to put a lot of emphasis or attention on other diseases that we should be talking about, like HIV, like malaria, like TB, and the rest. What do you have to say about that? Is there anything you can tell us about it?
I just don't know how the medical world operates, but to me, I feel the way HIV was affecting the world in the 80s when it has just come up, probably it's the same as maybe Corona. Maybe that's the reason why the attention shift has been to, COVID-19. But I can say that people are still having sex, unprotected sex, just to mention that. People are still living a life that people are not testing for HIV. People are relaxed about the fact that HIV still exists. I think as an activist, we shouldn't just shift attention, because I understand right now there are people who cannot move from district to district. Now, I'll bring in the aspect of stigma in a way that because of stigma, a person who is, for instance, living in, let me say, I come from Agago district. A person who comes from Agago district is unable to comfortably pick medication from Agago district. You'd find someone who picks medication from Agago going up to Gulu. People even go as far as going to Kampala just not to be identified as a person living HIV. Now, what does that mean? It means since you're in a lockdown, someone who picks medication from Kampala is unable to pick their medication. And still, because they are fearing people from, getting to know they are positive, yes, government has said you can go and pick medication from wherever you are, from the district that you're in. But because of stigma, still, they cannot go and pick their medication. Now, to me, that should trigger us in a way that let's not focus so much on one and ignore one sector. Because I can say, as a person living with HIV, I may not be able to transmit HIV, but there are people out there who are not on treatment, who are not taking precautions. They are still going ahead to infect other people. So I think we shouldn't lose focus. Thank you so much, Monica.
I even do not know what to say. Share with us your 3 rules, or I can say your philosophies. You are glowing. You are a happy person. Mind sharing with us that? Your top 3 that you said, these are the that, yeah.
My first thing is, I cannot change it. I cannot change the fact that I'm HIV positive. And there are people out there who believe maybe there's a cure or all that, but medically, I know there is no proven cure of HIV. And this is something that we have been told that you can live with it, but as long as you're on your treatment. So me, the first thing is I had to look down in myself and say, can I change this status? My journey of living negative ended on 2nd of January 2017, and another journey of positive living started thereafter. So the first thing, you cannot change your status. That is the first thing. You cannot change it. But now, to me, the thing that comes second is, how can I best live my life even now that I'm positive? 1, accept my status. 2, find ways of ensuring that I live longer and longer. And that comes with adhering to my medication, not allowing anything to stop me from taking my medication on time. Because I'm making 5 years of living positive with HIV. I haven't been sick. People who live around me, my friends and family members, they know I have never been bedridden because of, HIV. I've never been in a place where I'm unable to go for work because of my status. No. But yes, there are times when I have to miss work in the morning and go for my appointments, take blood draws and pick, have a refill of my medication. So to me, those are the basic 2. Then the third thing that keeps me going is every time I share my story, there is always someone who reaches out to me and tells me, you know what, Sarah, I really feel I was going down the drain, but now I feel I am picking up myself. So those are my 3 basic things that keep me going.
Okay. Thanks a lot for sharing that with us. Earlier on, I was talking about keeping positive or staying positive while you're positive. And you have turned this situation around. Other than most people, or I should say, some people live in a very, very negative way. You keep quiet about it, you don't talk about it, you don't want to inspire any other. You have made this kind of like a blessing in this. Do you talk to do you go to schools? Are there opportunities where you go give talks about sex education just to inspire people? Schools, maybe corporate places. Are there opportunities like that?
Coming out about my status has opened up doors for me, though I cannot say monetary doors to be specific, but yes, I have such opportunities that come up. Having a full-time job, I may not say I am full-time into reaching out and going into various places. I do that in partnership. I volunteer with 2 major organizations. Those are my good friends. That's Tokens of Life Uganda and Barbara Kemilisa Foundation. I'm so proud of Barbara. She's one of the people that I told my status from the beginning, and she really accepted me the way I was. And I go out to schools. There are times we go out to rural areas to spread this message, because so many people, for instance, in such a space, we are able to receive this information via Zoom, but the people in the rural areas were unable. So we do that a lot. Before, when schools were open, we moved to schools. I've had opportunities to travel out of Uganda to pass on the same information. Yes, I do a lot of reach outs.
So I really think from my side we are done. I'm grateful for you. I'm not the only one who is inspired by your story. You are easy to talk to. It's just a beautiful thing. For those who have just joined, I think we are wrapping up. Yeah, we're wrapping up. Questions, this is the time. Sarah would love to answer them.
Thank you so much. This is Steven. And I would like to ask this question that I know there are very many young girls around there that maybe they want this answer. That will having HIV affect my pregnancy? Sarah, I beg you to answer that, because I know there are very many young girls out there who may need to get the answer as you speak to them. Thank you.
Monica, maybe I'll take all the questions and answer them at once.
Yes.
Well, thank you so much. I would like to thank you, Sarah, and your friends for organizing this kind of arrangement. I have to appreciate Sarah so much for the kind of dedication she has really put in this whole thing. I'm Sarah's workmate at MOOCs, and I have some little experience I have to share in regards to Sarah's disclosure of her status. I remember by then I was completing my undergraduate studies, and you used to look as a very, very principled person. So I have to admit that her disclosure of her status, it was really a shock to me that I had to even go to her inbox and confirm whether what she has posted on Facebook is true. With the time, I realized that Sarah's disclosure of her status taught us a lot of lessons to take from. And I believe it changed my life so much. Due to the fact that we are working in a very volatile environment of an institution. This is an environment whereby it's characterized by students who are of that age of excitement and, the environment that is there. So I felt like it was a blessing in disguise for Sarah to come out, because I believe even now when she goes to some of these programs and meets these students and talk to them, I really feel like it is changing a lot and it is really doing a lot to the institution. Personally, I feel like Sarah is a heroine, and I really don't know how much I can describe her, but it takes a lot of courage, it takes a lot of commitment, and I know zero to come out and you really disclose yourself to the public, and more so in that kind of environment where we are working in. The question I might be having, usually talks of you equals you, and she always say that undetectable and something like that. And it's about someone who adheres to the medication and it reaches that moment where is untransmittable. I think that's how it ends. So my question is, if you reach at that point, is there any moment where you have to stop taking your medication and you are back to normal, or you have to keep on taking medication until because now I really don't understand that concept. If you reach at that status of you equals you, do you stop taking your medication, or you have to keep taking medication? And in case you stop, can you now transmit the disease to another person? Otherwise, I think you so mean Arena Albert.
Thank you, Albert. Sarah was is preferring, I think, which is even better, by the way, that she takes all the questions and answers them at once. Ancestor, you have a hand up.
Yes, thank you so much, Sarah, for sharing today. And it takes some courage to come out to the public and tell the world what you are. I really appreciate that. And I still believe HIV is still going to be a challenge, way beyond even the COVID that we are facing right now. My question is revolved around your working environment. As someone working in a student environment, you've mentioned going to sensitization drives and then talking to these young ones. But what do you think? What do you think the students are doing wrong? I'm very afraid that universities are becoming like a breeding ground. So how can we help these youngsters? Probably talking to them is one thing, but then I'm also very interested in what is it that they're doing wrong. Thank you.
Thank you, Ancestor. I don't see any other hand up. Maybe, do we have more?
Yes, Sarah, we have
Semanda and Olua Eddie.
Thank you so much, Sarah, for being Christian enough. What you does others yet to learn of their status. Next time, at least when they learn, they know, yes, you can have this, but you can also live with it and still cause a lot of changes in your society. What I needed to know is from your speech, like I'd written also in the comment, someone can also think that since Sarah has been sharing this, so it looks like it's just a smooth road. You can have HIV and then all shall be well. There is nothing completely. So one can also be reluctant and then doesn't protect or keep him or herself very well and then catch this virus. So I needed to know, what message do you normally go with to the public, or you can have for the audience here today, that can deter them from getting so relaxed, and then maybe from your submission they get so comfortable and then this is just a smooth road. Thank you. Otherwise, I appreciate you so much for your time and then your submission. It's been awesome. Thank you.
Thank you, Eddie. We have Brenda.
Okay, thank you so much, Sarah and Monica. I would really like to salute Sarah for coming out. You have really a big and bold heart. If so many people can really do what you're doing, I believe we would have a different trend in the nation. You are an inspiration to so many people outside, and there is hope upon getting infected with HIV. Currently, we are having coronavirus. It has actually put on hold. Everyone is not talking about HIV, yet it exists. So I believe we should be having more of this sensitization to the young ones and the entire nation, so that they do not know that getting infected is like casting stones. There is still hope and life after that. My question to you is, I'm told it might not it's a medical question that if you constantly take your ARVs, you get to a point where you test negative. They don't get any virus in you anymore. I don't know whether you've had such an experience during your time of taking these drugs, and if so, what makes the viral load to maybe get back? Because I expect it gets to zero. Maybe in one way or another, we would also expect miracle to happen. Maybe the virus to clear. Maybe if you had an experience of that kind, you share with us. Otherwise, thank you so much for now.
Okay, thank you so much, everyone, for your wonderful questions. Thank you, Steve. Thank you, Ancestor. Someone called Ancestor. Joshua, Nasa, whom we missed, Albert, Brenda, and Steve. Thank you all for your questions. I'll just quickly run through them. I'll start with the last person who asked about testing negative. For those who follow me, I once shared about, I use the same names. I usually do my activism on Facebook. I shared about an experience I had testing negative. Yes, I know I am positive. My viral load has been undetectable from 2017. I got undetectable within 6 months of taking my medicine. That means, one, the medicine was working so well. That means my body is really doing well. And apparently, when you take out a sample from my body, you would have no virus will be detected. Actually, they say virus not detected. That means I am in a place where I've taken my medication so well, my body has responded to the drugs very well, and I am unable to transmit HIV sexually. Now, how does the whole issue of a person who is negative, who is positive, get to test negative? It happens. I can even. We were with our friends. Actually, we were in that day. I remember we were somewhere. Okay, I will share with you two incidences that led me to starting to test. One, I was getting to a relationship with a guy. That was after getting to know, after my status, and we decided to go and do a test. Boyfriend, girlfriend. We decided to do a test, and when we walked into the hospital, we went into a hospital, and a very good hospital in Kampala, and both our results came out negative. Now, you know that trigger where you go to test with a boyfriend, and yes, he's negative, you're positive, but your tests come out negative. That was my first trigger. He was in a place where, how come you told me you're positive, but how come your tests are coming out negative? That was the first. Then there's a time we had gone with Tokens of Life, we had gone to Buvuma Island to do activism. Then in the evening, when we were just chilling with the team that had gone with, people just decided to do random testing in the evening when we were chilling. So I also put my finger and said, you guys also test me. I know you know my status, but also test me. So when they tested me, it still turned out negative. Now, to me, that is something that triggered my mind. Why? If I walked into a hospital with a boyfriend right now, and probably and this happens for specific tests. There are tests that no longer detect me as positive. That is one thing that even if you came with it right now and tested me randomly without even telling me that you wanted to test me, there are tests that we do that test me negative. Why? Because I'm highly undetectable. I don't know if there's any doctor here that can explain that, but to me, I feel because I've taken my medicine so well. Albert asked a question where, do I still need to continue taking my medication? Definitely, yes. When I continue to taking my medication, it means I am not allowing the virus to build up, because medics believe the virus is hidden somewhere in the lymph nodes, somewhere where there are certain tests, there are certain regular tests that we usually do cannot detect. You get it? And the regular tests that we do, we are not testing for the virus. We are testing the test that you and your boyfriend go to do in a clinic and all that. You're not testing for the virus. You're testing for antibodies. And these antibodies come in a way that when the body is exposed to HIV, it produces antibodies. Now, the regular tests that we do, those are antibodies. To know my actual, right now, if you really want to believe that I'm positive, you may not do a regular test because it will show you that it is negative. If you want to know my status right now, it's best to go into deeper science tests. I don't know how the labs can say that, but they may have to do a DNA test that will detect from the inner side that cannot be detected. Yes, and someone asked about pregnancy and HIV. That was Stephen. Yes, right now, if I conceived, my child will turn out to be negative. Why? Because my viral load is highly suppressed, because the risk of transmission is very, very low to my baby. And we have seen positive mothers who have given birth to children who are negative. They have grown to be negative, but it takes quite a point where, as a mother, you need to be very sensitive in a way that you take your medication, you protect your baby from any other, infections that may come in. And it's basically the mother that needs to protect the child by taking. The cases of mother to child transmission usually occurs among mothers who are not on treatment. That is why we encourage all positive mothers to go in for treatment. Yes, when U equals to U is true, it's confirmed. Me, I know I cannot transmit. I'm going to joke and say, if you want to know that I cannot transmit, you need to try me, but that's just a side joke. And working environment, what are the students doing? Yes, I work at a university, that's Makerere University Business School. And yes, people are having sex. We cannot hide our heads in the sand. Young adults are having unprotected sex. Young adults are in a place where you're in a hostel, then the environment gets cozy. Before you know it, you've already had unprotected sex. Above all, you've had sex without testing and getting to know the status of your spouse. So to me, I feel we may not bury our heads in the sand and say these people are not having sex. They are. University students are highly engaged. If not, they are the highest participants in the sexual world. But what can be done? I think we just need to get this information to them, that why risk your life if you can really know the status of the person that you want to have sex with. Test, test, test. To me, my message is test, test, and test. If you get to test, you get to know someone's status. Me, I was in a place where I also ignored. I looked at my boyfriend and he looked as if he doesn't have HIV. He really doesn't look like someone who has HIV. And to me, because of that eye testing that we usually do, we take certain things for granted. So university students shouldn't take things for granted. Test, test, test. If you must really have sex, to me, yeah, I'm an advocate for abstinence, but if you really must have sex, make sure everything is in place to ensure that you do not contract the virus. Okay, I think I've answered most of the questions. Monica?
I want to believe that Brenda was asking if there's a fellowship, especially for children who've been born with the virus, and along the way they get to take medication. And as they grow older, they are told why they're taking this medication. So she was asking, as they go on, they further their education, that kind of stigma lowers their self-esteem. Brenda, if you can hear, please go.
Yes, I remember that question. Sorry, thank you. Sorry, I remember. It's really unfortunate that a child is born with HIV, because this child did not call it to themselves. They were just born. To me, I take responsibility for my status because I got HIV at an age where I am above 18. I knew the risks around, so I may not completely blame my partner. But what happens when a child is born with HIV? Yes, I know it's a hard thing to have your child on treatment from the word go, because these children are given ARVs from the word go. So it can really be depressing to a mother. It can be depressing to a father, to the parents of this child. And I have interacted with parents who just do not know how to tell these children that, you know what, you are actually positive. I was once approached by a parent, and You know, this child was born, she was the last born in the family. The parents, the children ahead didn't have HIV, but she was the last born in the family. And this child reached a point of 11 years and asked the father, that daddy, why is it that my other siblings do not take medication? Why is it that I am the only one taking medication? What does that mean? It means this child really didn't know why she was taking medication. I know it's one very difficult thing to know, to let these children. I'm in a space where I interact so much with these children who have grown up to the extent of their 20 years, and they still do not know how to accept the fact that they were born with HIV. They have reached an age, probably 25, where they would want to, they would want to have a spouse, but every time they disclose their status to this man or woman, you would find someone running away. So this is something that is very difficult to deal with. And before the lockdown, I had a program that would really bring in all these girls together, all these boys together. But because we cannot meet physically, it became hard, because we would meet and chat and talk and see how best can we make our lives much better. Because I felt they're lacking certain things. They feel at the age of 25, they haven't yet accepted. Me, I was able to accept my status within 4 months. But you're talking to someone who is at 25 years and still they haven't accepted the status that they were born with. So I agree with him, with Brenda, that yes, I had a program before, but because of the lockdown, we have paused a bit. Being the fact that these children, some of them do not even have phones to reach out to us. But it's something that I hope everyone on this call can look out to it, and we see how we can help these people. Yeah, thank you. Then someone, okay, sorry, Joshua mentioned we make HIV look so easy. Yes, we make it look so easy because we have seen stories from the time HIV came into this world. From the 80s, if all of you can relate back, just have a flashback. Was this the kind of picture that you had about HIV? Yes, we need to appreciate science that we are able to look the way we look. We're able to look the way we look because there's treatment, there's better health care, but still that shouldn't make someone out there to think that because we look the way we look, because we seem okay with it, it's a pill that you wouldn't want to take. Yes, I am okay with taking my pill because one, remember what I told you, it's something that I cannot change it. I always caution people that if you still have a chance of not contracting this virus, all the power is in your hands. It's in your hands. Me now, I don't have any power because I've already contracted it. I can't turn back the clock. So if you still have the chance that some of us wish to one day get a cure, and we are saying we are negative, why not? So if you still have a chance, do not make the way we look make you think it's an easy journey. To me, yes, it's an easy journey because I've accepted it. I'm a warrior, I keep going, but it's something I don't wish for anyone. That is why I came out to show you the picture, so that when you meet that girl, that boy, and you don't just have to look at them and think this is the man or what. You need to take extra precautions. Thank you so much.
Thank you, Sarah. We have a question, kind of, or she's saying, how can she help a child who has contracted HIV from a father? I think she was forced into sex. That's what she's saying. Yeah, I want to believe that there is a way you can.
Okay,
I don't know. That's
that is all the questions we have today. Is that all?
Thank you so much for the great initiative. I'm sorry my network cut short, but I want to thank you, Sarah, for whatever you do, and also fighting the stigmatization among the patients. And we believe that the future is bright with people like you. What I wanted to ask is that how can we support such initiatives of HIV activism? You're talking about Tokens Uganda and all that. So I don't know how we can really support and see that they continue to forward the message to very many people as indeed we build our country. Thank you so much. Stay Semanda Abdunasser. Thank you.
Plus, maybe any contacts or directives to Raquel, who seems to be asking how she can help a child who contracted the virus from her father.
Okay, that's really sad. I know there are so many sexual violence acts that are happening around the world, around this country. It's even worse during this pandemic, this lockdown season, where children are locked up with their fathers, with their mothers, and it's really sad for what such a child would be going through. It's quite traumatizing, and I believe such a child needs to, one, have all the love and support from within. I still ask myself that if I didn't have the love and support from the beginning, from the day that I contracted HIV, I don't know how I would be right now. So for the beginning, it's good that she's concerned about this. Such a child needs support from within. That is the first thing. The support system from within is very, very important. And there are organizations that reach out to such children. If she doesn't mind, I'll share my WhatsApp number on the platform, so that whoever wants to reach out can do so, and we pave a way forward. But such a condition, you don't just deal with it here. It takes a lot of counseling. It takes a lot of input from various parties. But I know anyone can get out of any situation as long as there is massive support around them. Yes, Nasa, you talked about support. I do volunteer. This is something that we are not paid for. This is something that comes out of our hearts. We sacrifice a lot to ensure that this message reaches out there. So you can support, yes, by reaching out to these foundations that I volunteer with. I am confident about them because I know they do things that I'm really passionate about. You can always reach out, and whatever support, if you want to be part of our team, every time that we have to go to the field, we always welcome people as long as you share the same vision with us. Then also you can give us financial support from every part that we may need. So that is basically it. Thank you, Monica.
Oh, thank you very much. I want to believe that we do not have any more questions left. We've gone beyond the time that I requested to have with you. Unless there is any other, I would like to say, and I'm not the only one, Sarah, that you shared the story with us to inspire us. And of course, the whole nation. Like I was saying before, you were a gem for us. Please continue doing what you do. And thank you for sharing your number. I would like to get in touch with Sarah, especially for help and all that. Yes, you can take it up from there. I'm not going to read through all the comments here because, yes, we can read them. Unless there is any other, Sarah, that you would like to tell us, you are welcome so that we can adjourn this.
Thank you so much, Monica. Thank you so much, everyone who has been part of this call. I believe you have taken one or two things to me that is very important. My parting shots would be, don't let this information remain with you. There are hundreds of people out there who would want to know whatever I've shared today. There are people who need the support. There are people who are around you. I lived with HIV without disclosing for 4 months, and people around me could not believe that I was the one. But to me, that means you're sitting next to someone who may be positive and struggling and just cannot know how to deal. So be a support system no matter what. It may not just be HIV. You may be having someone who is struggling with cancer, someone who is struggling with any other condition. Most times, all we need is your heartfelt support. We really don't need much. We just need you to we need ourselves to stay stigma free. All we need is your support, if I can say that. Then if you know you're positive, please let this virus remain with you. To me, I promised myself that I am not going to be a reason why someone else is complaining that I infected them. That is why I take my medication. That is why I do everything possible to ensure that I do not infect. So if we all join hands together and fight this virus, I believe one day we shall wake up and say we fought this together. Thank you so much, Monica, for having me. Thank you everyone who has been part of this call, and I hope we can have more of these conversations ahead of time. Thank you.
Sorry about that. I forgot to ask, other than the telephone number, if it is okay for us to follow you on social media, and if it is, maybe you give us the handle. Then to people who joined late, I'm seeing people joining now when we're wrapping up. We will be able to get this recording on YouTube and then on my social media pages. Yeah, and you will also be able to get it from Sarah. Yeah. So Sarah.
Okay. Thank you so much. I use my names all through. I use Sarah Poro. I basically do my activism on Facebook. So you can reach out to me on Facebook and Instagram, still the same names. And yeah, basically I'm more into Facebook because I know majority of the people that I share my life with are on Facebook. Yeah, thank you so much. I am not really so much of everywhere on social media, but yes, that's where I can be found. Thank you.